Understanding bruxism.
Bruxism, or teeth grinding, is a common condition where people clench or grind their teeth, often without realizing it. While it can happen at any time, it most frequently occurs during sleep. Bruxism can lead to jaw pain, headaches, worn teeth, and disrupted sleep, making it important to understand the causes and find ways to manage it.
Why teeth grinding happens at night.
Nighttime bruxism often links to stress, anxiety, sleep disorders like sleep apnea, or misaligned teeth. During sleep, you may not be aware of jaw movements, causing unconscious grinding. Some medications, caffeine, and alcohol can also increase the risk. Identifying the underlying causes is the first step toward effectively managing this condition.
The impact on your sleep and well-being.
Frequent teeth grinding disrupts sleep quality and can worsen feelings of tiredness or irritability. Over time, bruxism can damage teeth, strain facial muscles, and even trigger tension headaches. Addressing bruxism not only protects your oral health, but also supports better sleep and overall mental well-being.
Mindfulness techniques for bruxism.
Practicing mindfulness and stress reduction can help manage bruxism. Techniques such as deep breathing, meditation, and progressive muscle relaxation relax the jaw and body before bed. Being aware of jaw tension during the day and reminding yourself to keep your jaw relaxed can also reduce episodes of teeth grinding.
Effective strategies to stop teeth grinding.
Creating a calming bedtime routine, limiting caffeine and alcohol, and avoiding chewing on pens or gum can help. If bruxism persists, a dentist may recommend a custom mouthguard to protect your teeth. Addressing sleep issues and seeking professional help for stress or anxiety are also important steps towards lasting relief.